All right. Well, good morning, everyone. Thanks for coming. I'll call the meeting to order. The open meeting law has been met through the proper posting. We have an agenda in front of us. I'd like to entertain a motion to approve the agenda.
Killian will make a motion to approve the agenda.
Linda will second it.
All in favor, say aye.
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 Opposed, nay. Motion carries. Thank you. We were sent the minutes from our August 10th meeting. To ask if there aren't any questions that we move to or entertain a motion to approve the minutes.
I make a motion that we approve the minutes.
I shall second it.
Okay, any questions about the minutes? Okay, all in favor, say aye.
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 Opposed, nay. Motion carries. I think we're up to number 6 already, ADRC Community Engagement Update.
Okay, I will just give a brief update on just recent and upcoming. It is, yep. Okay, yep, it is. Yep. Yeah, yes. So recent and upcoming community engagement and activities. So we did have, in September, we did have an identity theft and protection training that we held. That was in Arcadia. We had a senior bingo event that was held in Independence with the Independence Public Library. We had a youth in transition training that was held on October 6th. That was in Arcadia. And then we do have, so coming up, we have a virtual book club that is being started by our dementia care specialist. That starts October 20th. And then we have a Let's Chat series, which is a drop-in and let's talk. It's a chat that is scheduled with our dementia care specialist. She's going to be doing information and recommendations and support on dementia. And she's also going to be doing memory screens. So that will be coming up in November. She has 6 dates around the county that will be occurring.
And who is that?
So that's our dementia care specialist. So again, it's just outreach. It's scheduled for Whitehall, Arcadia, Strum, Blair, Osseo, and Independence. And again, she's going to be doing these memory screens. And again, the main goal too is also just information regarding dementia. So just outreach. So those are the big events that we have coming up. Good. So there's 6 dates throughout November. So I can list them if you'd like.
Where do they meet in Independence?
At the library.
Oh, everything's at the library, okay.
Yes, Osseo City Hall, which is, the library is part of that City Hall in Osseo. But yes, these events are all at the libraries in Strum Library. So I think those will be just a good opportunity for people to meet our dementia care specialist. Does anybody have any questions about the outreach and engagement that we have planned?
Just a comment about that. Could it maybe possibly coordinate with some of the senior meal things, like at the Wannick Center? The seniors are there anyway for that. It would be kind of nice to have the dementia person there.
Yeah, that's a really good comment. I don't have a calendar. Does anybody have a calendar? Is November 12th, is that on a Wednesday or Friday? That's a really good suggestion.
Friday.
Okay. Okay, good. And so she does have it planned from 10:30 to 1:30, so she'll be covering
Perfect.
before and after. So, yeah, she
Yep,
was
that's
thinking.
great.
Yeah, thank you for that feedback. Yes, again, so we're wanting to just touch as many people as we can. I can also just mention as well, just one other thing about upcoming plans. We do have a Strong Bodies series, so that is the fitness class for seniors. That is scheduled to occur in January. So more details will be coming for that, but it will be held at Brookside Apartments in Whitehall. So, two local individuals, so Amanda Heggie from the Whitehall Library and then Nancy Lingen, who is a Blair resident, will be leading that exercise class, and I believe it's a 9-week, 2 times a week they meet. So, so stay tuned for more details about that. We're thinking that's a good location, because hopefully individuals that live in the senior housing in Whitehall will be able to take advantage of that. So I think that'll be, it sounds like there is interest already is what I'm hearing, so.
Is there any age limit?
No, no age limit. So.
Melissa, does everybody at the table know everybody online too? So should we do introductions perhaps?
Sure, we can do that. That sounds good. So, my name is Melissa Youngbauer, and I am the supervisor of the Trempealeau County Aging and Disability Resource Center.
And I know Ashley's face is new at this table.
Yeah.
I am Ashley Brecke, and I am the Nutrition and Transportation Coordinator with the ADRC, and I joined in August, and I was at the last meeting, so you might remember my face from that.
I'm Dora Jean Blaha, and I'm from Independence.
Linda Schaefer, Whitehall.
Deb Sukla, Human Services. Those of you at the table, just press the little middle button so when the red light comes on.
Hi, I'm Victoria Pearson. I'm the new fiscal manager for the Department of Human Services.
I'm Mamie Beck from Whitehall. Ruth Gullicksrud from Strum.
Beth Killian, County Board Supervisor number 7 from Arcadia.
Alan Robertson from Blair.
Eileen Harrison from Gallsville.
Nancy Hubble from Yellsville.
Those of you online?
Mary, you want to introduce yourself?
Sure. Mary Frisch from Arcadia.
Scott Brown from Whitehall. I apologize for not having introductions earlier.
It wasn't on the agenda, so I forget about that, so thank you. I didn't mean to segue, but I want everybody to know who everybody was, so.
Is that everybody? Okay. Okay. I do want to just introduce Tammy. So this is Tammy Munson. And I think probably everybody knows Tammy. Unfortunately, I guess Tammy's probably going to be upset with me that I'm saying this now. But in the last couple of days, maybe Thursday, Tammy had announced she has accepted a position with the Extension Office here with the county. So she's staying with the county, so that's good. But we definitely, I can't thank Tammy enough for everything she's done to help me get adjusted with my role at the ADRC, and she will be missed. So, yes.
And we will miss you, Tammy.
Mm-hmm. Yes.
You're sounding very busy there, Melissa, with all the community engagement. It's wonderful that there's so much going on.
Yes, we've been busy, and we just continue to, have plans that we continue to work on, and so I think it's, exciting. It's an exciting time for the ADRC.
That's great. You want to move on then to the 2022-24 aging plan?
Yeah, so the aging plan is something that, I've been busy with the aging plan since I started, really. For those of you that aren't aware, the aging plan is a 3-year plan that we're required to, it's a list of goals, basically, of what we are going to focus on over the next 3 years. So when I started in April, I guess shortly after that, we started putting together a plan to obtain information, community input for our plan, basically a needs assessment. So we heard from more than 100 individuals from throughout Trempealeau County to tell us exactly what people felt were the most pressing needs in our county. Again, there was over 100 people that participated. Primarily, the way we collected data was from surveys. We did online surveys and we did paper, old-fashioned surveys. And out of that, then, we got a pretty good idea of what people felt were the needs in Trempealeau County. By far, the most pressing need and the most responses had to do with social isolation and loneliness. So I feel like for maybe a lot of us that work, in human services and work with people in the community, I feel like maybe that's not a surprise. That people really are struggling with feeling lonely and being isolated. We have seen the same kind of response when we did our surveys from 3 years ago, so I just want to point that out as well. But I do feel like with COVID, certainly that is something that has made that need and that concern, I think, even more prevalent. Just because people were at home for a lot of their time. People were isolating in their home based on really what have been the recommendations to keep everybody safe. So some of the other things that I will point out that kind of were reoccurring needs that in our most popular responses, our most, what we saw for the most feedback, were having to do with alternate transportation, help with home repairs and upkeep. And I will just say, I'm sorry, I should have said this, that I have given you the plan, so all of you have that. Towards the back of the plan that I've distributed, there are appendices, and the beginning of the appendices, there are the results of the surveys. So I'm reading them, but you do have them in front of you, so I'll just quickly go through with them. We also did see use of technology was a need, ways to keep fit and healthy. That was a really common one that people wanted to see. Dementia supports and services, support for family caregivers, helping understand Medicare and drug choices, and affordable housing options. So based on that information, I worked on our aging plan. I will also say that the state gives us a template. So there are specific areas that we do need to touch on as well. So I will just let you know that, so the state, I had to give them this template. They have received this and they did approve it. Now what the process is that today I am presenting this to you. You're all getting copies of that. We'll go through the goals, if that's okay with you, and I would like to get your feedback on them. And the next step then will be that we have to have public hearings. So there are 2 public hearings that are scheduled for our county. I did decide to do 2 of them, not just one. So we will be doing the last week of October. We'll have a meeting here at the courthouse. So people will have the opportunity to come in and review the plan and then provide feedback. I did use the suggestion as well as kind of piggybacking on one of our meal sites. And so we also will do a public hearing at the Wanik Center that last week of October. And so that'll be before the meal occurs. And so again, people will have the opportunity to look at the plan. It'll be there, and people will be able to give feedback. The plan also will be posted on our website. When I have submitted the notice of hearing, that will go into the paper beginning tomorrow, and it will also say, it says on there when the hearing dates are, of course, and also that it'll be posted online so people will know how they can access it. So once I get the feedback today, and once I get the feedback from the public hearings and any other input that's given to me, I then finish the plan with those suggestions. And then at that point in December 15th or 13th, the date is escaping me right now, but it's mid-December, the plan will then go to the Human Services Board. Hopefully, people are happy and satisfied with the plan, and at that point, they will approve it, sign off on it, and then it goes into the state. So does anybody have any questions about that process and about what we're looking at here today? Okay, so why don't we just start out? The plans are not, the pages are not numbered. So I will ask you to go probably about, and I made copies double-sided. I think it's 55 pages, so to save on paper, I definitely did it back-to-back or two-sided copies. And there is more information in here as well. It just has to do with the demographics of our county. I guess I will say that as of January 2021, the population of residents age 60 and older is a little bit above the state average. It's at 24.8. I think we can just use the figure 25% is what our county is at as far as residents ages 60 and over. So a significant portion of our population are considered seniors. So if we look at, again, the goals for the plan period, and they're not really in any order, but we'll kind of just go through them piece by piece if that's okay. And people, if you want to just, if persons want to just let me know, raise their hand or just speak up and say if you have any feedback about the plan. So the first focus area is nutrition and person-centered services. That is definitely a focus area that the state wants us to address. So that, but it is also, I think in our surveys, we saw that people want access to nutritious food and options in our county. So the goal that I have had for our 3-year plan is increase program participation. Oh, sure. So it's actually, and I tweaked it a little bit, so I'm going back to my. So the goal really has to do with equitable access. Equitable access to dining.
It's on the back side of this page. So it's on this side. Back side of the short page, right at the front.
So the goal really is, just to highlight again, is equitable access to dining from, to residents from throughout the county. I did just include, I thought it was interesting, and I thought maybe this would be something that you would like to see, but it is a map of our county, and it lists, it shows us, it's just a visual of where our dining sites are right now. So if you really were to take it take Trempealeau County, our long, narrow county, and split it in half, right now we do not have any sites in the northern part of the county. So we have heard that. Ashley, as our nutrition coordinator as well, can attest to that we do hear the comments about that. If we look at our data right now, it definitely shows that people from the northern part of the county, they're not driving in large numbers to other parts of the county to access the dining. So we want to work on that over the next 3 years. How we plan to do that is to really explore and look at other counties, look at what's working in our in the southern parts of the county, and just kind of come up with some options of what we could do for these other parts of our county. Ultimately, then, we hope to have a list of some options, and then we hope to get feedback from the council and the board, and to have some listening sessions in the northern part of the county to really find out, would that go over? Is that what people really want to see happen? Because I feel like we kind of need to get in and touch the people from other parts of the county and make sure that those ideas that we come up with are going to work.
Just so you know, there's a lot of ideas floating out there. There's the idea of the food trucks. I know I was just up in Osseo a couple weeks ago when they were having the music on a Monday night in the farmer's market and the food trucks, and the food truck was very popular. But then we're working more broadly in human services of creating, and this is a lot, Melissa's done a lot of work around this, these ideas of friendship centers and how do we work with schools, kind of like what's going on at Wanik Center. How do we make that more broadly across the county? So maybe we would partner with a school in the northern part of the county to have that open a day or two a week, that there could be like a senior center in some part of the building, and they already deliver meals for students, so why couldn't they do that for seniors? So I think there's all kinds of possibilities out there. I think that it's actually a kind of a exciting time. It's not like how can we force people to show up, but what would most excite you to get you to come? So I think she's got lots of things going on at the same time, so I think that this fits perfectly with that, and she's excited about moving those pieces together.
Yeah, and just to point out again, when Mary talked about just combining things with the dining, I just think there's so many opportunities. So again, if we can get something started, or even our existing locations, really looking at touching those folks and providing education and providing those support groups, those memory screens, I think that's the way that we can touch the most people and have the biggest impact. So it's a really good start in some parts of our county with kind of how we are combining some things. And I just kind of think we've got some really positive things happening, and just kind of the sky's the limit and what we can do and accomplish. So
I think you're going to have more of a challenge in Oliva, Strum, Osseo, because they gravitate to Eau Claire. I grew up in Oliva, and I know just the fair, for instance, we never came to the Galesville. We went to the Mondovi Fair, and so I think this is something that a lot of people just get in their car and drive to Eau Claire.
I agree. I think that is likely some of the I think that's one of the main factors that things have not turned out to be successful with some of the things we've tried in the past. So yeah, I think we just definitely need to research, figure out options, and talk to the communities and find out.
I hate to put a damper on it, but
no. They are doing, I think, looking too at just what is existing and working. And so I think, Deb kind of mentioned they do have this event that is in that new park in Osseo, where they have the Brad Garber pavilion, or whatever that's actually termed, but they get a really good turnout for that. So again, just how, why is that working? Could we couple with them and do something? So So, so then once we have those, we get the data, we have the public hearings, and then we determine a strategy. And so definitely one of the things that is part of this entire plan is just evaluating then as well to see is it working, and looking at numbers again with the goal of making things more equitable to everybody from.
I think you're
from the-
working in the right direction, it just more or less advertising, get a few people interested and they'll draw more in.
Right.
Yeah.
Right. Yeah. Does anybody have any feedback or questions about that goal? I thank you, Dora, for that. I do think, yes, there's, each of our communities, they have their own, we have to approach all of them differently, for sure. Okay. Let's go on to health promotion and disease prevention. This is another required area. The state really wants us to be, which makes sense, they want us to be promoting and offering evidence-based programs in our county. So, goal is to continue to create partnerships and to increase our number of evidence-based promotion programs in, throughout this plan, so from 2022 to 2024. So, plan is definitely then we're going to be starting early in 2022, so we're getting really kind of a jump start because we have that really planned already. It's going to happen, is the strong bodies. So we want to offer that at least annually. It would be great if we could do that twice annually, but I'm happy that's hopefully, the plan is in place. We're working on details. The other evidence-based program that we hope to offer annually is the Booster Brain and Memory series. So that is something that also is evidence-based. That's something that the state is really promoting and wanting ADRCs and our dementia care specialists to be offering. And so that just has to do with, just kind of what it sounds like. It's activities and just different things that we should all be doing to keep our brain healthy. So, again, as we saw with the dining, we would be doing satisfaction surveys to be used after to make sure that we're meeting the needs of people and that people are satisfied with what we're offering. Does anybody have any questions or suggestions about that? Yes.
I don't have a question, but I know the health department has a couple of programs. The only one I can think of right now is like diabetes. Maybe ADRC can coordinate with the health department because they don't seem to get enough people to actually run the program. And they did have one of the programs, but with COVID, it ended. They're hoping to pick it back up because it was like a 4-week program, and I think they quit in the middle, or 6 weeks, so they got more to go. But I can research that too and see because I think that would fit in here.
Okay, yeah, that would be great. And that is definitely a goal of mine too, is just to continue with these partnerships. I have met with the new director of our health department, and I've met with Pat Malone from Extension. And so, again, when Deb talked about the idea of community centers or friendship centers, and just part of that being education, part of that being promoting health and wellness, that's definitely a goal of mine, is to continue to work on these partnerships with other agencies. And so I have been trying to let Extension and Public Health know about what we're doing as well. And if any of you are Facebook, if you belong to the group for the public health, they've definitely been promoting our offerings, so that's good. But yes, thank you. And again, this is a start. I certainly hope a year from now, when we're reviewing what we've accomplished during 2022, that we have a lot of other things. Again, the diabetes, that would be great if we could offer something like that for residents of our county. So I'm hoping that this is kind of a starting point, and that we have a lot of other things that we can say that we've done.
But now, you was mentioned that you're gonna do an exercise class at Brookside. When is that supposed to
It'll
start?
be starting in January, Mary Lou.
Thank you.
Yes, and so I had never been to the Brookside basement before. It was probably a week ago that I got to go see it. It's a wonderful handicap accessible space. It's a very big space. They have said that we can store our equipment there. We're hoping to have information that'll go out where people can actually start registering in December. So we'll definitely have flyers at the Brookside for sure. Awesome. Yeah. It's a wonderful program. People that have done it just love it. So.
It'd be too cold to go outside.
Yes.
Melissa?
Yes.
Melissa, have you reached out to the Veterans Administration at all? Talked to Steve about some of these same considerations? It seems like a lot of the veterans have need for, reaching out and getting together, and nutrition and exercise and all that sort of thing.
I appreciate that. No, I have not done a lot of outreach to Steve as far as what we're offering. So I really appreciate that. Deb can maybe mention some conversations we've had with Steve about another topic.
Our conversation with Steve around transportation, because that's what they deliver, a lot of transportation services, as do we. So how can we kind of make it a more efficient system? So we've kind of started to look at that. So that's where we've started our work with Veteran Services. But you bring up a good point, Scott. I think that we should be looking at some other ones as well. So thank you for that.
Yeah, that really hasn't been on my radar, really. So thank you.
You're welcome.
Okay, let's move on to caregiver support. And really, the dementia care specialist and Shelley Rui, who is really the lead with our caregiving programs, are going to be largely responsible for our caregiving goals. Again, this is a required area. What our goal is to increase the number of caregiving program participants, again, using our data system that the state provides us. So, just to kind of briefly go through this, launching a caregiver support group. We want to get that done by the middle of the year of next year, so June of 2022. Looking at just pretty much a kind of a traditional type of support group where people would get together and meet. So what we need to do is, again, we need to figure out surveying people, talking to the professionals that work in the field, like at clinics, and find out where does it make the most sense to start this group, because that has not been determined yet. Another strategy to touch caregivers is a memory cafe for caregivers and their loved ones. That had been in our previous plan. COVID kind of derailed that plan. But a memory cafe is really, it's similar in the sense that caregivers certainly can attend, but they are also really encouraged to bring in those that they care for. And so in a way it's providing support, but it is really looking at providing more education probably than a traditional caregiver support group. And it's also activities. So sometimes they would maybe, do an art project or something like that. The other strategy 3 has to do with launching a powerful tools for caregivers program. So again, that's a evidence-based program that the state is really encouraging ADRCs to get trained in and offer. So our plan with that would be to offer that annually each year of the plan. So our dementia care specialist, talking about her a lot, Becky is getting trained in the powerful tools for caregivers. That is a program in the past that I do know that Extension has had people that have been trained in that. And so we would definitely be looking at, partnering and having health department and Extension help promote that, if not partner with us with that program. The last strategy number 4, has to do with really the feedback that we've gotten from our consumers in our county, and the state really kind of encouraged me to add this goal, which now I'm really glad that I did, because I didn't have it on my original list. But it is starting a handyman or chore services program for our county. So what that really is it would be, and again, we need to research that and determine how we would do that. But we do get a lot of calls of people saying, hey, I need help with doing my raking this fall, or I need help installing a handrail in my bathroom, or I just, when I have light bulbs that need to be changed, I don't have anybody that can help me with that. We get those calls, and there's not a lot of people that we can say, hey, call so-and-so, they could help you out. So it is researching other counties, and we have a lot of examples. There are a lot of counties that do have programs that meet that need. So it's researching what other people are doing, and then it's getting out and talking to groups like Lions Clubs, or it's talking to schools. For example, I did just have a school this week now that reached out to me and said, hey, do you have things we could do on October whatever is later this month, because we have a group of high school juniors that need projects to do. So that is also a way we could do it. We could partner with schools and have kind of community cleanup days, that type of thing, with those established organizations. We could have more of a traditional list of people that keep up a list, and then we could give that to people, and it would be they would be able to arrange for those services with the people that, the volunteers on the list. So a lot of ways we can do it, but I think it's a need, and I think it could be a really neat thing. Again, meeting the need, but again, filling the gaps, and maybe addressing people's need to belong and to be having a purpose and wanting to be helpful. So a lot in that goal. Scott, did you have something to add? Yes.
Yeah, sorry.
No.
RSVP, Retired Senior Volunteer Program. I haven't been involved with them for a number of years now, but that was something that they enlist a lot of volunteers. I used to mow lawn for people, occasionally shovel snow, stuff like that. So I don't know if that's something that you'd like to touch base with them over at Western
RSVP.
Yeah.
Yeah. Actually, Cheryl Padula, who I believe is still responsible for that program, she is on our nutrition committee, so she will be here today after we meet. Oh, I guess Ashley's saying she won't be attending today. But we will, reach out. I had planned to do that today. So, but agreed, that is definitely, would be possibly a partner with that.
That would be through
Goal.
Western Dairyland. I
Yes.
used to volunteer for several years. I went to one lady's home, and I did all her shopping. And then I went to another one that just one day a week, and we'd bake cookies, and I'd do different things that She said she can bake, but she can't do it alone. And it was more of conversation. That was in Arcadia, both these ladies.
Was that through RSVP?
Well, RSVP and Western, but Western,
Yeah.
Cheryl had said it.
Cheryl,
up.
okay.
Yeah.
Okay, good feedback. Anything else with caregiver support? Okay. We will move on to racial equity. And so the goal really, and this is another, these are all required areas of focus. So the state really wanted to see a racial equity goal. And so the goal is to increase participation of our services by our Hispanic or Latino community. And so basically the plan has to do with meeting with community leaders. That is a conversation I have had with the health department. They have a similar goal, is to increase participation with the health department as well. It's great because he actually does have a list that he's already started to put together of community leaders. And so definitely want to work with him and outreach to that population and explore, things like dining, transportation. How can we make it easier for individuals to access our services? So a lot of that is just researching and determining what others feel we need to do.
Melissa, I
Yes.
think Extension has done some work in this area too.
They have too? Okay.
And they've just hired, Monica, who is Hispanic or Latino
Oh, okay.
in the department, so,
She does some of our interpreting for us too.
Yeah.
So, I think that's a great idea.
she'd be a good resource.
Okay, great. There are some statistics in here regarding the Hispanic population in our county. What we know is that the numbers are rising, and like just our population in general, people are aging. So the higher numbers of that population are in the younger ages, but we'll continue to see the numbers of seniors rising. So, okay, supportive services. So we do know that there are a lot of needs in our county for transportation. We get a lot of calls. It keeps Ashley very, very busy to try to meet the needs, transportation needs in our county. We probably have most days, I would say, there are people that we are unable to fulfill the request for transportation. So we're at this point really looking and trying to determine what can we do to increase our ability to provide transportation to individuals. So we've been talking about consulting with other counties. We've been, the plan also does have us exploring technologies that may improve our ability to meet those needs. And strategy, oh, and I do see a typo here because I have 2 strategy 3s. So really it would be strategy 4 would be to utilize recruitment strategies to expand our volunteer driver pool. So, does anybody have any questions on that goal?
I just kind of do.
Mm-hmm. Yes.
You refer to talking to other counties.
Mm-hmm.
How much more information do you get from doing that? I mean, how do you help each other, I guess?
Well, we help each other. Basically, there's a couple different ways. So The local counties, for example, like Buffalo and Pepin, we have a pretty close relationship with them. La Crosse and Eau Claire, we have a pretty, and Jackson, yes. Those are the ADRCs that I have the closest relationships with. Yes, the ones that are just nearby us. So that's who I would outreach to as well. But there are also our forums where we can reach out to ADRCs from throughout the state and ask them about, you know, how they're fulfilling needs.
Are they pretty much like what we're doing? What you're doing?
To be honest, I don't know. I don't really know what other counties, I don't have a lot of knowledge on that. So it really is kind of starting at the beginning and finding out what are other counties doing.
Because that would be quite an effort. I mean, you have to determine whether it's worth that effort or not.
Mm-hmm.
Or if you can directly meet with them.
I think a lot of it could be done via email, via video meetings. Yeah, I do know that a lot of other counties do have technologies that, you know, possibly may help with that. Right now, you know, Ashley's got just a system that she has, you know, made basically herself. So I don't know, but definitely wanting to explore what can be done.
My daughter-in-law is with Jackson County.
Oh.
She's health director.
Okay.
And I don't know if she helps with the ADRC over there or not.
Yeah, she supervises the ADRC as well.
Pardon?
Chris supervises the ADRC as well.
Oh, really?
Yeah.
That's
She does
funny.
health
When
and
I
human
asked her
services
question,
now.
she's totally
Hmm.
quiet. Good.
So, yeah, she supervises both of them. So again, I think that, you know, a neighboring county can learn some.
But the majority are volunteers, and so, I mean, I do think that just strategy for recruiting volunteers is going to be key. Community engagement and advocacy. Those are our final two focus areas. And community engagement, basically what the state has recommended to me is they want, and I kind of alluded to this more towards the beginning of this conversation, but they want us to be getting more feedback. Again, not waiting until right before our next plan, so not waiting until 2024, but having ongoing engagement with the community and getting feedback about whether or not people feel that what we're doing is meeting the needs, or finding out if people feel we need to add new goals or adjust our goals. So that's really what this is saying. And so when we have, for example, like our Strong Bodies program, when we start that in the beginning of next year, getting that feedback, doing a survey to find out, you know, to get that feedback about the service. Which makes a lot of sense to me. I feel like that is something that we could be doing a better job on. So again, I'm glad that they suggested that to me. And lastly, the advocacy, just getting more people trained in Trempealeau County. And so GWAR, or the state, does have training programs that actually, so this is more, again, education, but it would train individuals and providing opportunities for people in our county to learn more about advocating for needs that are important to our county and important to our seniors. So we hope to do that annually. And then providing opportunities and identifying opportunities for our advocates to put their skills to work. So that has to do with, you know, letting people aware of when there are meetings, who are our legislators, and how do you get a hold of them. So that's just kind of a whole effort that, again, is public outreach and informing our citizens on how to best do that. So that's a lot.
You've been busy.
Yes, it's a blueprint of what for the next 3 years. What feedback, questions, suggestions, concerns? What are people's thoughts?
I was just thinking about the transportation situation, possibly, turning back to the RSVP program, and then also maybe sending out some sort of announcement or some type of feeler program to all the churches in the area, asking the secretaries to put in the bulletins that, the ADRC is looking for drivers, volunteer drivers, just explain it a little bit, and then they could call in and get more information. But it's just a couple thoughts there.
Yeah, it's.
I think there are a lot of people out there that would be willing to volunteer, but they just don't know the program. If you have never had contact with the ADRC or any volunteer driver, then you may not be aware.
Definitely, yes, thank you.
Would there be a special phone number if we had to put it in or don't, in the bulletin?
It would be the ADRC number, so the 538-2001. I think this again is just something, just promoting all of what we do is just got to be ongoing. Again, now this last week, Mike Gilbertson on WHTL has been talking a lot. I mean, the focus has been, and I tell him what to say, and that this week has been all about volunteers. We've been highlighting a volunteer in our most recent newsletters, and so this week, our most recent newsletter has been Donnie Sem, who is one of our most used volunteer drivers, and so it's really just talking about Donnie's experience and how Donnie really enjoys what he does. Maybe if any of you have heard Mike talk on the radio this week, that's what you would have heard. We do again try to get the newsletters out to the churches, and that information is always in the newsletter. So I just think it's just continue to just ongoing highlight, the needs that we have for volunteers. So, and I think some of you had requested information for your church bulletins last time we met. And so Tammy had helped me send out that information that could be shared with your churches.
I think I mentioned before, too. It comes into the office at our church, and we never hear any more about it. And I don't know how to fix that.
Yeah.
Except we have a newsletter goes out once a month, and I was going to make up something that would inform everybody that read the newsletter, because that's to every member of the church.
Right, that would be great.
But I talked to the secretary, and I showed him what your newsletter has. And he didn't quite know how to word things. Rather than copy everything down that said, well, that's ridiculous.
Well, so a couple things about that. If you could give me the contact information for him, and then I could just share the information with him that could be put in there. So I had seen even like the Chamber of Arcadia, their newsletter last month, they had a really nice write-up, I thought, prior to the start of the Wanik Center. But that's information, that even like that, I could have emailed them. Most people would want it in email because then they can just put it, insert it into their newsletter. But I think that's one of the most valuable things that advisory council could do, is to kind of know those contacts and those opportunities in your communities and let me know how I can,
Tell him to call you.
Yes, or you could give me that information and I can contact him.
Okay.
Absolutely.
Okay.
Yes, we want to use what's already established.
Yeah.
Right. So that would be great.
Hard to condense it.
Mm-hmm. It is, and that's why even for the radio, I focus on just about every week, I give him a new piece that I want him to highlight for, because I do send him the newsletter too, but yeah, it's a lot. He doesn't know really what we want to promote at any given time. So I cue him in on exactly what we should be promoting.
So I should give you your number?
Either way,
And give him your number?
yes.
538-2001.
Mm-hmm.
Okay.
Yep. Yes. Is there any other feedback? I know that's a lot. If you have any other ideas after you leave this, you probably want to look at this after you leave, and maybe you'll see some things that don't make sense or surprise you. You can join us at our public hearings coming up later on this month, or you can just call me as well and give me that feedback.
Probably send one of these to Scott.
Yes, for sure. Yes. Scott, I'll send you all of the people attending, all of the members attending. We'll send you a copy of the plan in the mail.
I can
Thank
take
you.
one for Mary.
Okay.
See her later.
Sure. That's all.
Is
Go
there
ahead.
something in this second half that we should specifically read? Because I don't think I'll read the whole thing.
I think the goals would be
That's the front part,
yeah,
which we just.
it's starting at about page 10. Right.
The title's 3 and title 6.
It's,
I won't know what it is.
yep, it says goals for the plan period. So then it's the focus areas. They want to make sure they can hear you. So I think that's probably,
So ready to
Probably-
move on to congregate dining then?
sure. So I did in addition to the map of the county, I also had included, Tammy had helped me put together just a rough draft of our congregate dining for 2021.
It might make sense to do the budget first and
Okay.
then come back to this, if that's
Sure.
okay? I think that gives us better information, if you don't mind. I apologize to those of you online. You don't have a copy of what I'm handing out, but we can certainly send one out to you. What's being handed out is a summary of our levy request. It isn't our total budget, but it's a good snapshot of what we're requesting for levy for our programs. And the little marks where I have the check marks on the left-hand side, just pay attention to those. Economic support and justice and all of those don't pertain to this body. But the long-term support, the ADRC, and then all the senior services programs at the bottom pertain to this body. Does that make sense to all of you? Okay. So in long-term support, we did ask for some additional levy there of about $5,779. We are probably looking at moving, we're also not on your agenda today, but in a separate topic, we're looking at doing a little bit of reorganizing in our department. We have a supervisor vacancy right now. And Melissa and 2 other supervisors have 10 to 12 people that they supervise, full-time positions, and that's a lot. And this other vacant position only had 3. So we're looking at kind of shifting a few people on the organizational chart. So the long-term support piece may move away from Melissa's responsibility. So, but for now, it's under Melissa, and so that's what that is. The ADRC, we only asked for a very modest amount of money in there. A couple things that I should note on that piece of the budget for the ADRC is when we prepared this budget in August, we understood that we had the dementia care grant for our 3 counties that we serve, Trempealeau, Buffalo, and Pepin. Unbeknownst to us, the state changed some allocations and gave Buffalo and Pepin their own dementia care specialist. So that's good news. We can have our own. Bad news is we only got half the money. We're going to get half the money we would propose to get. So our poor gal that had just started with us is like, oh my gosh, what am I going to do? So Melissa and I did some good advocacy with the state, and the state has met with us, and there's only, I don't know, maybe a handful of counties, not even a dozen counties that were affected. The reason we kind of got caught in that bind is because we shared our dementia care specialists with other counties. That's not the case in most ADRCs, and it was those counties that ended up a little bit short. So the state has met with us. They are going to make us whole for 2022, and we'll have conversations about for 2023. And then, of course, the next goal is for the state biennium is to ask for enough money to pay enough money to all the counties going forward, so for 2024. So we were able to fix that, and we were able to get that funded. We were able to get that extra $40,000 back, so that was good news for us. So I want to tell you that. The other thing is in the ADRC is the ADRC lease expires January 31st of 2022. Our landlord, of course, is a pretty sharp negotiator, and so the request that's come in has been close to 40 or 45% of an increase in rent. They want us to pay the taxes, which there's actually, as of September, I don't know if there's been any change, but as of September, they actually have some back taxes owed, and then they want us to pay for the insurance for the building. Well, the county doesn't want to get in the business of paying taxes because we collect taxes. So the Human Services Board met last night, and because we're on camera here, I'm not going to say the amount, but we budgeted a much lower percentage of increase for rent. And so we're going to have the Corporation Counsel, who's been doing our negotiating with the landlord, negotiate up to that amount. If the landlord plays strong arm, and maybe they will, maybe they won't. I mean, they kind of probably are like, well, where are you going to go if you're not in that building? We've already talked with the Exec Finance Committee, and we've talked with the Human Services Board, that in the event we cannot come up with a lease that is a reasonable amount, we are prepared to move the ADRC back to this building at the end of January. It won't be ideal. We'll have to move a bunch of Human Services staff into the Trempealeau room where you sometimes meet and turn that in kind of into a cubicle farm, kind of as we call it. But that will be for about a year and a half-ish until the ADRC has space in this building because of the construction project. We'll have staff doing more remote work during that time. Again, it won't be ideal, but if need be, we have a backup plan. So I just want you to all know that. So we, in this budget, we have a lower amount budgeted than what the landlord is asking, at least at the onset of the negotiations. We're still, our goal is still to come up with something that is a reasonable amount that fits with our budget and could keep people in the ADRC building. But I just wanted to give you a heads up on that. So our, actually, as you noticed, Human Services is split into two funds. And so we have, the top part is the Human Services Fund. So we actually can see the totals. We're actually taking $9,000 out of other accounts in the Human Services to put towards the ADRC or long-term support, or to, as you can see, we're moving almost $7,000, $6,901 to the Senior Services Fund because they need more levy. Some programs are going down. The home delivered meal program, obviously you can see there's an increase in levy there. So our total request was actually a negative $2,000 for our budget. So it was a modest reduction for the overall Human Services. More specifically to the congregate meal program, we have budgeted about $9,000. Average would be about, oh wait, make sure I'm looking at this right. About $9,200 a month for, about $9,500 a month, I guess, for operating the Pine Creek site, and then for the contracted amounts for the other sites. So if you look at that, and then if you want to go back to the congregate meal page that looks like this on the back of your agenda, based on the utilization that we're seeing, if we keep boondocks at 5 days a week, we will be about $1,000 a month over budget, and we will have no money available to open up another site in the northern part of the county. So that's, I wanted to give you that update as far as our budget. So I wanted to share that information with you. If we had boondocks at 3 days a week where they used to be, then we still have funding available to be able to look at a site in the northern part of the county. So again, we were able to expand boondocks this year because we didn't have as many sites open. And of course, the Wanik site is getting a lot of utilization, so that's great news. But of course, there's cost to that. So we want to be able to kind of sort those pieces out. So again, how you want to go from the budget piece of it, I just gave you a quick summary of that, to how you want to talk about this piece of it. If you do keep boondocks open 5 days a week, that really, if we want to expand in the northern part, we'll already be over budget, and if you want to expand in the northern part of the county, we would have to find some additional resources to do that. So that is kind of what's on your, the options that you have for that part of the discussion. Yeah.
And what about Rainbow?
Rainbow is,
5 days a week.
they're at 5 days a week. We could cut them back. The big difference is boondocks per meal is $8.25, and it's $1.50 less at Rainbow. So if we cut them back, it won't have as much of an impact as boondocks, which is our most expensive site right now.
I guess the other piece just to mention too was originally the Boondocks contract was for 3 days a week.
It had been that for many years.
And then back in May, this council and
The
the
Human
Human
Services
Services Board approved that we increase it to 5 days a week throughout the remainder of 2021.
And we had funds to do that because we knew we didn't have sites open and there was a big request. So we said, well, why, rather than leave money unspent, let's do that. But now if we continue that practice, and we told them that this is only for 2021, but if we continue that practice, again, it would put us in a spot. You had a question, I'm sorry.
Why are there the different prices that you pay to each?
Sure. So that's part of the bidding process. When we open up we bid out every 3 years for a contract, and so we tell the vendors what we're looking for, and so they tell us what it's going to cost to do this. So they have told us their cost is that much higher.
One other thing, just maybe it's really not clear probably on here with the Pine Creek site is just how that operates.
You want to explain that?
That's odd. Oh.
Okay. We'll
Okay.
continue.
Yes. So the Pine Creek site, which is in operation 2 days a week, it happens on Tuesdays and Thursdays.
And we had boondocks the opposite days of the week. So because Pine Creek and boondocks, when you look at that little map, aren't real far away from each other. So that was the thinking at the time.
So with that Pine Creek site, that is different than our other models because our other contracts they're contracts with restaurants. We pay the Pine Creek site. We have employees, people that are paid by the ADRC, people that are paid by the county to make those meals and to serve those meals. We also pay them to go to Winona, which is where they buy the majority or the bulk of the food for those meals.
So if you look at their costs, it looks so much less than everybody else's, and that's because the staff costs aren't in there. That's just the cost of purchasing the food.
Well, then how much of the new Wanik Center is?
We don't pay, so all of the other sites really, so the Wanik site, for example,
There, by the way, Wanik is at $7.55 a meal, $7.55 a meal for comparison.
and so the way that it works is Ashley Pub gets a number the day before, makes those meals the day of that they serve them, they deliver them to Wanik Center. So the $7.55 covers everything that that Ashley Pub does. We don't pay Wanik Center anything to operate out of that. We don't pay the Pine Creek Church, I believe it's called Sacred Heart, is that the name of it? We don't pay them anything either. But
Yeah, they've been donating that
the
space for many
difference
years.
the difference would be you know, the model, the other model is that a restaurant, you know, makes the meals and either delivers it like they do to Wanik Center, or at Boondocks or Rainbow, the restaurant makes the meal and serves it right there. So that Pine Creek is the only site that we're actually paying staff, you know, totally to operate that site.
And I'm only concerned about boondocks that's in my backyard.
Oh, sure.
Mm.
Yeah, that's
I'm
okay.
not more than that.
Mhm.
I will say that we have noticed the number of meals going up during, like, the average number of meals at Rainbow or average number of meals at Boondocks is higher than it was normally previous years. I think it's because people just are looking for opportunities to get out and do something. I will say that our number of meals at Pine Creek is actually a little bit lower than what it used to be. So we're going to have to look. I just noticed that as I was looking at this. I'm not sure what that is. If is carryout. I don't know how the carryout piece of it works. So we'll have to just look at to why that utilization is a little bit lower than what it used to be when the others. And again, at Wanik, and I get there's a grand opening. So, but Wanik per day, we're averaging over 50 meals a day. That's higher than we've. I mean, 20 to 25 meals is a great day. We see that. Just taking the latest month, in September, Rainbow averaged about 20 and a half meals a day. Boondocks averaged about 26 meals a day. And Wanik, again, for their 5 days they were open in September, averaged a little over 50.
Wanix are open 5 days?
No, just 2.
Wednesday and Friday.
That's what I thought.
Would it be cheaper if you cut down in the Boondocks than other places?
Again, because the cost of the meals vary from place to place, it kind of, again, because they're the highest one, if you cut down from them, it will have the greatest impact. And the reason that that's on the table is because historically, for at least the last 10 years that I'm aware of, they had been 3 days a week. We switched them to 5 days a week because it was a request by a board member to look at that, and really we had unspent funds because we didn't have as many sites open in 2021.
It won't be so high
Right.
in prices.
So yeah. So anyway, that's the reason that's on the table, is because historically they were 3 days a week. We went to 5, which is unusual, and they are our highest price vendor. It's okay. It just, when you change their numbers, it provides the greatest impact.
So each place where they have senior meals are charging $4?
Yep.
Well, when we went to Rainbow last time and went to pay, they said $4 or nothing. What's that all about?
Well, that's not the way it works.
No, it's not the way it should work.
But we appreciate that feedback, so
Yeah.
we can check into that. Thank you.
$4 or nothing.
Yeah.
And I said, well, I'll pay it $4 because, you know.
The way that it's supposed to happen is that we need to give all of the participants an opportunity to pay for their meal. The suggested donation is $4. Although people, I mean, it is an option. Somebody could go to any of our sites and not pay anything, or a person could put in a $10 bill and just leave it.
Or
and
put in $1.50 because that's all they have.
Yep.
Those are all, it's a suggested donation.
Yep.
I just get the feeling that maybe that family that has Rainbow would put in the $4 if we said nothing. I think they would make that right.
Well, we need to explore that.
Yeah,
and,
that ain't how it
'cause
works.
that isn't at all the way it should be working. So yes, thank you for the feedback. Yes.
I have 2 things. I would like, before we would decide to cut Boondocks down to 3 days, I would suggest asking the participants, because if they like the 5 days, you know, I hate to say, well, now you can't come 5 days, you know, so feel them out before a decision was made. And then the other thing is, you know, could we do the suggested contribution and up that to $5, because that's not that much. I myself, sometimes, I'm not dealing with trying to get change for 4 ones, so I
So I
put in a
will say
$5 bill.
that I am also working on a report for the state that is supposed to be due annually. It was not done last year because of COVID, so nobody in the state did it. But it's a whole way we determine what the suggested donation is. So we will have that by the end of the year, and that most likely would go up because that $4 again, it was not redone last year, but it's a whole formula as far as what the costs are. There's a lot that goes into that to determine, that's how we come up with the $4, so.
We have to get the state's permission to ever change that, so it's an option. We upped these amounts in 2014. We haven't upped them since. At 2014, we were one of the highest counties around. So we haven't upped it because, again, it's a suggested donation. This is for seniors that live on fixed incomes. We want to be very considerate of that. But it is something we could look at in the future.
I have to add to that too, he knew that we had come from an ARDC meeting when he told us what we had to pay.
Can you
He knew we were from this
Oh.
meeting and stopped there to eat.
Well, Melissa, we're
That
not
might have
getting
been
any of this
his reason.
conversation because people aren't using their microphones.
Mic on?
So the conversation has to do with the cost, the suggested donation of the meal, and Nancy had indicated that she had gone to Rainbow after our last council meeting, and she says she was told that you can either give $4 for your meal or nothing. So we said that that's not the way that it's supposed to work. The suggested donation is $4, but people could give in any amount or give nothing at all. So that's something that Ashley and I will have to explore. And then Beth had suggested possibly raising the suggested donation, which that is something that, yeah, because she had her mic on.
So I was
Yeah.
able to hear her.
Okay.
We'll be stopping there again today, so.
I kind of want to follow you and see how it goes.
And we do go there. Ashley, since she's been with the ADRC, has been there several times. Ashley and I went to Boondocks. I had not been there before. We went there maybe 3 weeks ago. So just to meet with them and see how things were going. It was busy.
I think traditionally Rainbow just uses their own employees to ask for the donations. And I know when the City Cafe or the Sunflower Cafe had a contract, that generally was manned by a volunteer or woman by a volunteer. So, they were pretty much trained by the ADRC. So if, the word passing down from, employee to employee at Rainbow, maybe they just are a little bit confused. We know how that telephone game works. You tell a story from one person to the next, and it changes drastically, and, by person 3 usually, so. Is there any, we need to pass anything, put out forth any motions for this, or is it just informational at this point?
Only if you wanted to take action on the Boondocks, which I think your recommendation is that we, at least what I've heard so far, is that we talk to the individuals that are currently going to Boondocks. We'll probably go on the days that they wouldn't typically have served in the past, so that would be on the Tuesday and Thursdays, and kind of look at those numbers, talk to the individuals there. Again, we'll look at these numbers a little bit sharper, see if there's a way we could continue that. When does this body meet again?
Not until December, yeah.
So in December, we'll have to make some decisions. The Human Services Board and this body will have to make some decisions on that contract. we can be in touch with them and let them know that it's, you know, being discussed. And so as they're ordering food for the next month, not to necessarily just assume that they will be operating 5 days a week.
Yes.
Yeah, because
I
again,
really think,
go ahead.
I really think that making things more equitable throughout the county should be our primary goal, rather than to serving 5 days at Boondocks at the cost of possibly not serving someone in the northern part of the county.
And we might be able to come up with a little bit of, you know, we might not have those sites developed until summer. So maybe until summer, we could continue 5 days a week or something. So we can look at those kind of options. I don't want to cut them off and then say you're 3 days a week or 4 days a week, and then we have unspent money at the end of the year, because that's not anybody's goal
Right.
either. But I appreciate
Right.
your point, Mary. Thank you.
I don't know too. Part of me does think maybe it would not hurt to explore other ways of making Pine Creek more, to lower costs, I guess, at Pine Creek. I don't know if anybody has any, so again, I'm not suggesting at all that we eliminate a site, because no, I think it's important, and we would want to continue. The goal is to provide, you know, nutritious meals to individuals in that area, but, you know, would there be ways to cut the costs there and still make people, still provide a healthy, nutritious meal, and have consumers or, you know, residents of that area still happy with what they're eating? So, yeah, I don't know if anybody has any suggestions or comments regarding that.
It's a very good meal, and there might be rebellion there.
Yes, it is.
There
Good
will
meal.
be rebellion. I can assure you.
Any change.
Yep.
Does anybody have an address for that Wannick Center?
It's on
An
here,
address?
someplace.
It's on here someplace, I saw it.
Is it in that
And a
plan?
nutrition thing, maybe.
Talk to me after the meeting.
Okay. The reason I asked is we had to go there for a ball game last night,
Put on your
and we had
microphone.
a terrible time finding it.
Oh, it's
Until
on-
we
it's
came
on-
across
it's
the
on
car
board
that
game.
was carrying the referees, and we followed them to the ball game. It's the only way we found it.
Well, it's right connected to the high school and the middle school, so
Yeah.
it's all part of it,
Yeah.
yeah.
It's kind of a trick to get in there.
Know where they are.
Right now,
Yeah.
because they're doing work on this roads over there. Because I went to the Rod and Gun Saturday night, and I go there all the time, and I had to drive to get into the park.
Yeah.
Yeah.
Thank you.
That's all I had, Scott, on this topic.
Very good. Thank you.
Scott, that's all I had on this topic. Thank you.
Okay, you bet. I just want to put in a plug in case you have to go to the Trempealeau room. My cubicle was in that room for quite a few years, underneath the clock on the west wall, so it's a good working environment. If you need to go there, I think it would be fine.
Yeah, the longtime staff have said we've been there before.
Yep. Deanne Anderson and Melissa Frank and I were all in that room, along with a bunch of other people too. Number 10, Roman.
Okay,
Shabilla's
this is
donation.
just a quick piece. You know, we have talked in the past about the Roman Shabilla donation. Last night at the Human Services Board, they did approve a resolution to establish a non-lapsing fund for that donation. So again, that was $20,000 that he had donated.
The non-lapsing fund, what allows us to do is it allows us to put that money in an account and use it in future years. This year, we don't need it because, again, we've got lower utilization because of COVID. We got some extra COVID money last year, so we've gotten some. So we don't need it this year, but we know state and federal funds continue to become less and less, and so we will need it in the future. So it's just a way that we can account to the family of the donor that we have the funds and where it is and why it's there, and then it's available when we need it.
Great.
Sounds good. volunteer recognition.
Okay, so just kind of wanted people's feedback on this. Of course, we're already in October, and wanting to recognize our valuable employees. So my thoughts at this point had to do with, and we do have in our budget, we have funds to recognize our volunteers. My thought was to get the volunteers a nice gift. Maybe a couple different things are crossing through my mind, but to forego a banquet for 2021, and then with the plan of getting something established for next year and then doing that annually ongoing. The ideas that I had for a gift had to do with either a gift card for a local, possibly restaurant, and or possibly, we have had, for example, like my coat right now, it has ADRC logo on it. So it could be a gift card and some sort of a shirt or coat, umbrella. I mean, there's 100 different options. Or it could be just a gift certificate to give people. So just kind of looking for feedback. Do people think that that's not a good idea? Or do people have another idea this year yet how we could recognize our volunteers? Just looking for feedback.
I like the jacket.
I guess I don't like stuff with logos on it.
Yeah.
That's just me.
Mm-hmm. And you are one of our volunteers, so I appreciate that feedback, Linda.
Didn't hear what Linda said.
Linda said she doesn't like logos on her clothing.
I would suggest just going with the gift card, because I am in the process with my sister. We're both like trying to downsize.
Yeah.
So if I were a volunteer, a jacket or a shirt would be fine, but as a volunteer, I don't need any more stuff.
Okay.
But I sure do like to eat.
Yeah. I think that's good feedback. I mean, to be honest, like it would create quite a bit of work to figure out how do we sizing and what do people want, all of that. So then if people feel like gift cards are good, do people like the idea of some local county restaurants? Do people like gas cards, like a quick trip? What feedback do people have? And also looking for suggestions of what, and maybe if people would like, I could contact, if there are people that would like to, talk later, we could do that as well.
The gift cards would be nice, you mentioned but you have to consider where they live. If you would give, say you give them all to one place,
Maybe we could pick out a couple different establishments, and then I would call, if Ashley was a volunteer, and I would, possibly say, thank you so much, or even a card that says this, and say, these are the options. We'll get in touch with you sometime in the near future to tell us, where we can, get your gift card.
but you don't want to make it too complicated.
No.
Yeah.
Right.
Personally, I just think a card saying thank you is enough. Use your money for for transportation or whatever.
Unless you got money that you have to get rid of, that's different, but. Because, I know there's so much, sometimes you have to spend within a year, or it has to.
Well,
taken back.
it is in our budget to, it's in there. So, if it's not spent, how would that work then, Deb? It would just.
disappear.
I don't know. I
It
feel
goes back to
like
general fund,
you're
so.
being, really kind, Linda, and I feel like a nice note and card would be, but I do feel like, my gosh, we rely on you all to do the bulk of transportation, to do a lot of our meal delivery, so.
And they give a lot of their time, right?
They do.
I had gotten a Shields card, $25 gift certificate for Shields many years ago from RSVP, and finally just spent it this year. I think I had it for almost 5 years or something, so the idea of having something that's more local, whether it's a card for a restaurant or just Quick Trip cards you can use for almost anything unless it's specifically gas.
Yeah.
But,
Yeah.
there's Quick Trips all over the place, so.
Okay. Well, it seems like minus our volunteer who is being, it seems like people feel we should recognize them. And I guess if, the feedback we're getting then is local. And, Ashley is in touch with most of her volunteers weekly anyway. And maybe it would, maybe that wouldn't be so hard to find out what people would be interested in. So I think if it's okay, then we'll proceed with that for this year. Okay.
Sounds like a plan.
Okay.
Next, you said is ADRC Vehicles.
And maybe Deb, you can contribute some to this as well, but I will just mention that we do have right now in our ADRC fleet, we have 5 vehicles. We have 1 bus. We have another new van that we just started driving this summer, really. Both of those vehicles have the ability to transport individuals in wheelchairs. And then we have 3 other vehicles that are proving to be less reliable. We've had need to repair, I think, 2 of them. You can tell me. Ashley deals with this every week as well. I think we have 2 vehicles right now that are in the shop. Okay.
And they're primarily used for what?
Home delivered meals. Home delivered meals is, and then we have 1 other van that is currently in our southern part of the county that is operating okay. So again, that is also used for home delivered meals. So
the vans that we have, other than the newest van that we just purchased, have been purchased with state transportation funds. So we had to promise the state that those vans, although they might be used for home delivered meals, that they'd be available for local transport throughout the rest of the day. We do that occasionally. And so our options, we have a couple vehicles. One of them is a 2010, I think, or 2011, at least one of them is. So we definitely need to upgrade them. So we have 2, typically in the past, we haven't had any of these options. So I'm pretty proud that we as a county have positioned ourselves to be in this place that we have some options. So we have some unspent funds in the nutrition program that we've been setting aside because we know that the state keeps giving us less and the costs keep going up. And so we've set aside an account where we have some additional funds there. We also, because we didn't have a lot of people using the transportation programs last year during COVID, we have unspent funds in that the state has had us allow us to set aside. So we could purchase a vehicle out of either one of those, maybe even more than 1 vehicle, depending on what we want. If we, for example, I don't know, would we have to have a van, or could we purchase a car for home delivered meals?
I feel we could purchase a car. It couldn't be a compact car because we need to be able to get the equipment into the car.
So in the past, when we purchased vehicles, we didn't have this extra fund for home delivered meals set aside. Again, the purpose of that was for the delivery of typically we thought of it the cost of the meals. But we have quite a bit set aside right now that if we wanted to purchase a vehicle that's not handicap accessible, whether it's a minivan or a car or whatever's most cost effective, that we could go ahead, we could purchase that out of those funds. We'd take this request to the Human Services Board in December and get bids and get this purchased early next year. Or we could continue to use transportation funds and then use it for transportation. That then requires that we have to do a lot of reporting on it for all the transportation that's provided. So we could go either way on this one. If we do it for the transportation program, we may or may not have to have the handicap accessibility, which will add to the cost of the vehicle. Our last handicap accessible van we picked up was around $35,000-ish, and that was slightly used. If you buy them new, they're closer to $45,000 or $50,000. If you buy a minivan or a car, now we're talking closer to the $20,000 to $25,000 range. So that's a little less expensive. So we have some options on if you want to recommend using some nutrition funds to buy a vehicle solely for home delivered meals, or if you want to continue to use transportation funds, but then we have to do a lot of reporting on it. We also have to then make it available for the local transportation. And then there's some requirements in terms of accessibility with those vehicles. So in the past, we didn't have money in either one of those funds. We had to wait till the state once a year said you can apply for a grant. So for the first time ever, we're in a lucky position to be able to do this. We could purchase at least one vehicle, maybe two, but we'd have to kind of look at what kind of vehicle we're purchasing. So I've thrown a lot of information out at you. What else do I need to add?
The only other thing I would add is we feel that the one van, it's its transmission. And so just to explain what happens when now we've got two vans out, we have to rely on our drivers to drive their own vehicles, which we can do. The most recent person we hired, one of our paid drivers, he was under that. I mean, when he was hired, he was told he may need to drive his own vehicle. Some of our current drivers, two in particular, they really are not pleased with using their own vehicles. So and we're kind of getting feedback that if that were to be the solution, if we were to expect them to go long-term and drive their own vehicles, that they may not be able to or be interested in driving. So when they do drive their own vehicles, they are paid mileage, just so people are aware. So.
I know. Go ahead.
I like the van, but the seatbelt is the pits. We have to go way and then put it in really tight fit. So, but I like the van. It's just the seatbelt
The
is.
one that Dean drives?
Huh?
The one that Dean drives?
Yeah.
Okay.
But I says it's nice. It's a nice van. It's just the seatbelt is the pits.
That's good feedback. Thanks. Beth?
I know both the health department and the DLM department have vehicles. And I don't know about the health department, but the DLM has let, like maintenance use them. So
We actually have a fleet of 5 cars that we
Okay.
use for our social workers, and we have an agreement with DLM that we can use their vehicles if they have any not in use. So we can use those, but again, for human services, we need those a lot for transporting clients to medical appointments or kids to foster care visit, or from foster care to supervised visits. So those are pretty often checked out, so that's our challenge that we have.
And
I didn't mean to jump in, I just wanted to add to that.
No, but I was going to say, while these 2 vehicles are in the shop, there might be either of those departments,
Oh, I see.
something available to use in the
Temporarily.
meantime, and then they charge it back to whatever organization is using it.
And
Okay.
if they're really tight, you can buy this extra strap to put, and it just clips right
Extensions.
around, extend. Well, yeah, but they go over the seat belt, so they don't cut into your,
Yeah, it's kind of a padding.
yeah, they're padded. And they're not really expensive. My granddaughter gave me one that's really nice, because I'm so short it cuts into my neck. And that has made a difference in it. The weight doesn't seem as heavy on it. So that's probably something they could think
Yeah,
about.
Ashley is jotting that down. So I had not heard that comment before, so we'll look into that.
If you're short, you notice these things. Maybe you do when you're tall too, but I've never experienced that. so.
Right now, we are making do because we have a driver off, so we're able to play musical vans. Not ideal, but they're doing great. I have personally delivered home delivered meals using one of the human services cars. Not ideal, but again, you can make do, especially if it's one of the smaller routes where the coolers are a little smaller and the bags aren't the big things. So we could possibly get by with a car if we're doing the musical, vans, or we just know who needs what vehicle there. So I just wanted to throw that out there. So my hope is I can kind of keep everybody on a musical rotation so we don't have to get into the human services vehicles and, take away from transport or anything like that. So I've been doing a lot of juggling, a lot of creative scheduling. So we're making do, but hopefully we'll have at least one of the two out of the shop by the end of this week. So fingers crossed.
Thank you, Ashley. I think we've got the short-term crisis resolved, but again, the one vehicle is a 2010 or 2011. It's got a lot of miles on it. We've got to fix it so we can eventually sell it, but we're going to have to replace these vehicles. So the question comes back to is, do you want to purchase a vehicle out of nutrition funds solely for nutrition that we could buy for a fraction of the price compared to buying a handicap accessible van? Or do you want us to look at the purchasing a van through, or we could do one of each? I guess I just want to get your opinion on how you want to do this, because again, we're using funds that are set aside for future years, and I want to make sure we get your input.
That was going to be my suggestion, is to possibly get a small SUV, so that you could put any size cooler in the back, easily accessible out of the nutrition funds, and then something that's more accessible out of the transportation budget, even though it's going to be more reporting and whatnot. But it just makes common sense to me that, get two vehicles, one out of each budget, designated for that purpose, for those purposes.
Yeah, where the need is the most, I think.
I like your,
Do you need a motion?
I like your mask. Do you mean?
Or just advisory?
This is advisory. We can just take this to the Human Services Board, because what we'll have to do is ask their permission to get bids, and then we'll bring those bids back and get the vehicle going, so.
Thank you.
Anything more on vehicles?
No.
Any public comments that anyone has?
I think we covered a lot of.
Yes, I
Covered a
do
lot
have
of stuff
something to
today.
say. Oh, sorry. I do have something. I myself would not want to make the choice, so I was hoping, or if it's possible, these people that work for the ARDC make that decision, because most of us probably don't understand the choices. And, yeah, I just assume you all would make that decision.
Yeah, we'll look at the different options and we'll move that forward. We just want to see if you had any input. If the input was like, no, the meal or the money we've set aside for nutrition is solely for meals, so we don't want to use that money, that if you had that opinion, we wanted to know that now. If you don't have an opinion, that's helpful to us as well. So thank you.
Any other comments?
No.
Next meeting is December, didn't say a date. Just
I omitted the
21,
date, didn't I? 14th. Beth is saying 14th.
10:30?
At 10:30, yes. Okay, thanks everyone for coming. Thanks for all the updates and all the work you're doing, Melissa and staff. And we've come to the end of our agenda, so we can adjourn.
Okay, thank you. Thanks for joining us, even though you're not feeling good, Scott.